So, as I have mentioned earlier, there was a story about Gretchen. So, I forgot to put it on a slide. So, I'm just going to tell the story of Gretchen. So, Gretchen was asleep and bigla siyang nagising, and then she felt a little bit of an apprehension, and then pagising niya hindi siya makahinga, tapos yung paggising niyan, yung room niya was like was full of haze daw. So ayun. So in her case, where is it? In her case, parang nagkaroon siya ng panic attack while sleeping. So, there was something unusual about her situation. She was sound asleep when it happened. Approximately 60% of the people with panic disorder have experienced such nocturnal attacks. In fact, panic attacks occur more often between 1:30 a.m. and 3:30 a.m. than any other time. In some cases, people are afraid to go to sleep at night. What's happening to them? Are they having nightmares? Research indicated they are not. So they are nocturnal attacks, the nocturnal panic. So, yan. What causes nocturnal panic? Currently, our best information is that the change in stages of sleep to slow wave produces physical sensations of letting go that are frightening to an individual with panic disorder. This process is described more fully later when we discuss causes of panic disorder. So, ayun. Next is blood injection injury phobia. Almost always differ in their physiological reaction from people with other types of phobia. Blood injection injury phobia runs in families more strongly than any phobic disorder we know. So, ayun. Next is situational phobia. Phobias characterized by fear of public transportation or enclosed places are called situational phobia. Claustrophobia, which I have also, a fear of small enclosed places, is situational, as is a phobia of flying. So, itong claustrophobia, minsan nakaka-cause din siya ng panic attacks. Excuse me. From my experience lang. So, natural environment phobia. Sometimes very young people develop fears of situations or events occurring in nature. These fears are called natural environment phobias. For example, heights, storms, and water. Maybe you know someone na merong ganun. So, many of these situations have some danger associated with them, and therefore, mild to moderate fear can be adaptive. For example, we should be careful in a high place or in deep water. It is entirely possible that we are somewhat prepared to be afraid of these situations. So, yun. Something in our genes makes us sensitive to these situations if any sign of danger is present. So, we have here animal phobia 2, a fear of animals and insects called animal phobias. What are the causes? Direct experiences where real danger or pain results in an alarm response, a true alarm response. experiencing a false alarm, panic attack in a specific situation, observing someone else experience severe fear, vicarious experience, or under the right conditions being told about danger. So, Ost describes how a severe dental fear developed in this an adolescent boy sat in the waiting room. Tapos merong naririnig niya yung the other boy na ina-attendan nung parang nung dentist na siguro binubunutan siya ng ngipin. Parang sigaw ng sigaw yung bata kasi nga natatakot din. So because of hearing loud screams from the other child, parang nag-cause siya ng fear din dun sa boy na nasa waiting room lang. So evidently the boy's reaction to pain caused him to move suddenly, and the drill punctured his cheek. The boy in the waiting room who overheard the accident bolted from the room and developed a severe and long-lasting fear of dental situations. Yun. So, Ost also describes the case of a woman with an extremely severe snake phobia who had never encountered a snake. Rather, she had been told repeatedly while growing up about the dangers of snakes in the high grass. She was encouraged to wear high rubber boots to guard against this imminent threat, and she did so even when walking down the street. We call this mode of developing a phobia information transmission. Yes, yan. So, ayun. Pag talaga parang kunentohan ka na, uy, wag kang pumunta sa high grasses kasi may snakes doon, nakakatakot. So, if you really want to go there, wear boots. Nang dahil doon, pati kahit sa city, naka-boots na siya sa sobrang takot niya sa snakes. So, ayun, next is treatment. What is the treatment for this? So, the treatment is fairly straightforward. Almost everyone agrees that specific phobias are required structured and consistent exposure-based exercises. Nevertheless, most patients who expose themselves gradually to what they fear must be under therapeutic supervision. Individuals who attempt to carry out the exercises alone often attempt to do too much too soon and end up escaping the situation, which may strengthen the phobia. In addition, if they fear having another expected panic attack in this situation, it is helpful to direct therapy at panic attacks and in the manner described for panic disorder. So, ayun. May mga tao na pag may phobia sila or may fear sila, they conquer it by doing it alone. Pero sometimes or dapat every time na i-conquer nila yung phobias nila or yung fear nila, dapat meron silang supervision ng other people or therapist kasi they might go like parang gagawin nila yun, i-conquer talaga nila right away, which is too much and too soon daw. Baka umatras lang bigla tapos mas lalong mag-trigger yung phobia and mas lumakas yung phobia. So ayun. Pag ganun, if people have phobias, if they are really willing to conquer their phobias or their fears, kailangan may supervision talaga ng other people. So here, this is very familiar with, you guys, I know, are familiar with this one. Separation anxiety disorder is characterized by children's unrealistic and persistent worry that something will happen to their parents or other important people in their life, or that something will happen to the children themselves that will separate them from their parents. So, you guys know this. So, all anxiety and related disorders described in this chapter may occur in childhood, but there is an order that's, in treating separation anxiety in children, parents are often included to help structure the exercises and also to address parental reaction to childhood anxiety. So, social anxiety disorder or social phobia. We have here another case. Billy was a model at home. He did his homework, stayed out of trouble, obeyed his parents, was generally so quiet and reserved. He didn't attract much attention. When he got to junior high school, however, something his parents had noticed earlier became painfully evident. Billy had no friends. He was unwilling to attend social or sporting activities connected with school. This is a typical story of a child na parang ayaw niya talaga makihalubilo. Like, he was eating his lunch, or minsan hindi siya kumakain ng lunch niya, just closing himself in a cubicle in a CR. Yun. And his parents were really, really worried about him kasi wala siyang friends, hindi siya outgoing. So, Billy had social anxiety disorder. Sad is more exaggerated in shyness. Sad na hindi sad na emotions na sad, ha. It's social anxiety disorder or social phobia. So, what are the causes of sad? It seems we are also prepared to fear, angry, critical, or rejecting people. In a series of studies, Oman and colleagues noted that we learn more quickly to fear angry expressions than other facial expressions, and this fear diminishes more slowly than other types of learning. Lund and Oz demonstrated that people with SAD who saw a number of pictures of faces were likely to remember critical expressions. Mogg and colleagues showed that socially anxious individuals more quickly recognize angry faces than normal, whereas normal remembered the accepting expressions. Let's move on. So, what is the treatment for SAD? Effective treatments have been developed for SAD. Clark and colleagues evaluated a cognitive therapy program that emphasizes real-life experiences during therapy to disprove automatic perceptions of danger. This program substantially benefited 84% of individuals receiving treatment, and these results were maintained at a 1-year follow-up. This outcome is the best yet for this difficult situation and significantly better than previous approaches to which it has been compared. Next. We have trauma. We have trauma and stressor related disorders. This set of disorders, trauma and stressor related disorders, include attachment disorders in childhood, following inadequate or abusive child rearing practices, adjustment disorders characterized by persistent anxiety and depression following a stressful life event, and reactions to trauma such as post-traumatic stress disorder and acute stress disorder. So, ayan. Investigators working in this area concluded that these disorders did not fit as neatly with other classes of disorders, such as the anxiety disorders, as previously assumed. This is because trauma and stressor-related disorders all share a proximal instigating stressful event followed by intense emotional responses. Post-traumatic stress disorder or PTSD. So, ayun. PTSD is best known of these disorders. So, we have here the clinical description. Exposure to a traumatic event during an individual experiences or witnesses death or threatened death, actual or threatened serious injury, or actual or threatened sexual violation. So you guys probably know what PTSD is. Maybe you know someone na meron PTSD. Most likely, ang alam ko, meron to yung mga sundalo. Mga pulis, lalo na pag nakakapatay. They are more likely to have PTSD. As in, I know someone na yung papa niya may PTSD. Ayun. So, here we have Betty Jones. So you guys can you guys can read this, pause it. This is a case of PTSD. This case actually is unusual because not only did Marcy develop PTSD, but so did her 8-year-old brother. In addition, Kathy, 4, and Susan, 2-year-old, although quite young, showed symptoms of the disorder, as did their mother. So, this is sad. So, what are the causes of PTSD? PTSD is the one disorder for which we know the cause, at least in terms of precipitating event. Someone personally experiences a trauma and develops a disorder. So, what is the treatment? PTSD should face the original trauma, process the intense emotions, and develop effective coping procedures in order to overcome the debilitating effects of the disorder. So, we have here catharsis. You cathart. In a psychoanalytic therapy, relieving emotional trauma to relieve emotional suffering. So you guys know catharsis. Sometimes we cathart. Okay, so next, adjustment disorders. This describes anxious or depressive reactions to life stress that are generally milder than one would see in acute stress disorder or PTSD, but are nevertheless impairing in terms of interfering with work or school performance, interpersonal relationships, or other areas of living. Sometimes, particularly in adolescence, the life stress may provoke some conduct problems. The stressful events themselves would not be considered traumatic, but it is clear that the individual is nevertheless unable to cope with demands of the situation, and some intervention is typically required. If the symptoms persist, call a doctor. Charot. If the symptoms persist for more than 6 months after the removal of the stress or its consequences, the adjustment disorder would be considered chronic. Chronic. So, you guys know what's chronic. It's really severe na. So, we have here attachment disorders. Refers to disturbed developmentally inappropriate behaviors in children, emerging before 5 years of age, in which the child is unable or unwilling to form normal attachment relationships with caregiving adults. These seriously maladaptive patterns are due to inadequate or abusive child rearing practices. In many cases, these inadequate child rearing practices might be caused by frequent changes in the primary caregiver because of multiple foster care placements or possibly just neglect in the home. So, parang dito yata yung mga bata na papalit-palit yung yaya, or yung mga bata like yung mga bata na papalit-palit or palipat-lipat ng foster care, yung foster child, ganun. So, parang nagkakaroon sila ng attitude towards other people or their caregivers. Yun nga, yung attachment disorder. So, excuse me. We also have here reactive attachment disorder, wherein the child will very seldom seek out a caregiver for protection, support, and nurturance, and will seldom respond to offers from caregivers to provide this kind of care. Generally, they would evidence lack of responsiveness, limited positive affect, and additional heightened emotionally, such as fearfulness and intense sadness. Ayun. In disinhibited social engagement disorder, a similar set of child rearing circumstances, perhaps including early persistent harsh punishment, would result in a pattern of behavior in which the child shows no inhibitions or whatsoever to approaching adults. Such a child might engage in appropriately intimate behavior by showing a willingness to immediately accompany an unfamiliar adult figure somewhere without first checking back with a caregiver. So we have here obsessive compulsive and related disorder, or the OCD. You guys know what's OCD, diba? Among the persons suffering from anxiety and related disorders, a client who needs hospitalization is likely to have OCD. In OCD, the dangerous event is thought, image, or impulse that the client attempts to avoid as completely as someone with a snake phobia avoid snakes. Excuse me. So we have here obsessions. Obsessions are intrusive and mostly nonsensical thoughts, images, or urges that the individual tries to resist or eliminate. Compulsions are the thoughts or actions used to suppress the obsession and provide relief. So they come along together talaga. Obsessions comes with compulsions. Ayun. So we have here the types of obsessions and compulsions. We have symmetry, forbidden, cleaning and contamination, and hoarding. So, ayun. We have here the table. You can read it, you guys. Next is the tic disorder and OCD. Tic disorder characterized by involuntary movement to occur in patients with OCD or their families. Ayun. So, most likely tong tics is referred to as Tourette's disorder. Yung Tourette's syndrome, yung bigla ka na lang nag-click, tick, tick, ganun. Kung gusto niyo makakita ng tao na may tics or Tourette's syndrome, you can watch it on YouTube, or may mga tao sa TikTok na nag-share about their tics in life. And pag ikaw na tao na merong OCD daw, sometimes pag may mga bagay na nakakaano ng OCD-ness mo, yun, you have the tendency to have tics. So, the repetitive, intrusive, unacceptable thoughts of OCD may well be regulated by the hypothetical brain circuits. The tendency to develop anxiety over having additional compulsive thoughts, however, may have the same generalized biological and psychological precursors as anxiety in general. So, body and dysmorphic disorder. Its center is a preoccupation with some imagined defect in appearance by someone who looks reasonably normal. This disorder has been referred to as imagined ugliness. Ayun. For years, BDD was considered as a somatoform disorder because its central feature is psychological preoccupation with somatic physical issues. Etong sinasabi nila na body dysmorphic disorder or imagined ugliness is ito yung mga tao na feeling nila kahit ang ganda na nila or ang pogi na nila, maayos naman yung mukha nila, wala naman sira, hindi naman sila na disgrasya or anything. They see themselves as ugly people na pangit talaga, hindi lang sa mukha, pati sa body nila. So, ito yung mga tao na laging nagpapa-enhance ng lip enhancement, nagpapa-bridge ng nose kahit maayos naman yung ilong. Parang mas lalo nilang para sa kanila mas lalo nilang pinapaganda yung sarili nila. Kasi kung hindi nila gawin yun, parang feeling talaga nila ang pangit-pangit nila. So yun yung BDD. So next, yes. Where are we? So we have here this is a case actually of BDD. So you guys can read it na lang. So next is other obsessive compulsive and related disorder, hoarding disorder, trichotillomania or hair pulling disorder. And the tricho or hair pulling disorder is the urge to pull one's own hair from anywhere on the body, including the scalp, eyebrows, and arms. Oh my god. You guys know what is hoarding disorder naman, di ba? Yun yung mga tao na kahit ang tagal-tagal na, there was this person na 10 years ago na yung newspaper, tinatago niya pa rin kasi it might be useful, in the future. So, what is the use of a newspaper from 10 years ago? So, maybe if you're parang artist or mahilig ka sa artwork, it might be useful, pero I don't get it. From the previous pala, BDD, they have here, they have here Michael Jackson as their example. Pero Michael Jackson, I believe, was reconstructing his nose kasi he is having problems of breathing kasi nga kailangan ng maayos na na form nung ilong niya. That's why papalit-palit siya ng ilong. And not because of his appearance. I believe Michael Jackson loves his his color, loves his face. Maybe, just maybe, he had conditions. That's why, ayun, nagkaroon siya ng, he needs to reconstruct his face or anything. I don't think na meron siyang BDD. Maybe because kailangan niya lang talaga magpa-reconstruct. So, going back to hoarding disorder, yun nga, there was this person na, ayun, nag-hoard. Like, kahit alam mo nang wala na siyang silbi, hindi mo pa siya tinatapon. Kailangan mo na siyang itapon. Ayun. So, here in trichotillomania, this is very weird actually. Lahat ng buhok mo, pinupull out mo. This behavior actually results in noticeable hair loss, distress, and significant social impairments. This disorder can often have severe social consequences, and as a result, those affected can go to great lengths to conceal their behavior. So, we have excoriation. Skin picking disorder is characterized, as the label implies, by repetitive and compulsive picking of the skin and leading to tissue damage. Oh my God, this is even worse. Kasi skin mo na, how would you feel? How would you feel picking your own skin tapos nagkakaroon na ng tissue damage? So, ang deep nun ng picking niya. So, that is very painful. So, ayan. That would be all. That's my report. If you guys have questions, you can ask me or Ma'am Lala, of course. So, ayun. Ang dami ko din natutunan. And so many surprising events and situations and informations in this report for me, because I personally I am experiencing one or more of one or two sa mga tinakel ko ngayon. So this is very helpful, and thank you. And thank you so much.